Thanks, Liz. So my name's Omar. I'm the CEO of Red Ninja. We're a SME based in Liverpool in the Baltic Triangle, and we've been going for 3 years. So that's the team there. That was taken last weekend, actually, on the skate park next door to our studio. Be careful, though, I fell off and hurt my ribs recently. But as you can see, we're all very young, all very into mobile technology and disrupting systems and trying to leverage app development, big data, Internet of Things. And we've decided that we want to work in healthcare because we think we can have the most impact. And that's what fits the values of that team there. So yeah, app development. We started off making mobile apps 3.5 years ago. And we realized to make good mobile apps, you need good data. So that got us into needing to understand about data. And we have data scientists who work with us, who work for us. We have electrical engineers who help us develop sensors. We have designers and programmers and an open innovation lead. So everything we do is done in a sort of open innovation way, and we use design thinking. So we're not experts in healthcare. That's where we work with you. And we're experts in technology, and we think by working together, we can create solutions that are going to benefit people's health. So I'm just going to talk about 4 or 5 of the projects and technologies which we've developed in healthcare. And then I'm going to talk about how we've worked with the Northwest Coast AHSN and how they've really helped power us and go to the next level, really, in accessing the health sector. So one of the technologies we're most proud of is called peace of mind technology. And it's a sensor which we developed with the University of Liverpool Electrical Engineering faculty, because part of our job is we run the incubator for the university. So any interesting technologies coming out of the Faculty of Electrical Engineering and Electronics, we commercialise that technology and work to get it into industry and get it into the market. So what this technology is, it's a sensor. It's about the size of a smoke alarm, and you stick it on your ceiling, and it uses chromosticity technology, which is essentially looking at microscopic dots of colour, and it uses infrared technology, a little bit like Xbox Kinect, the games console, which is controlled by movement, and it can tell if someone falls over. So it's a passive sensor. You don't need to wear this sensor, but if you're an older person in a room on your own and you fall over, this will detect that, and it'll call a carer or some sort of support service. And we've trialled this technology in a care home, and it's come back with 100% success. It's been independently evaluated, and we're getting this into the health sector, and I'll talk about how we've done that with the help of the Northwest Coast AHSN later. Another interesting product which we've developed over the last 12 months is called Helping Hand, and you can get a demo of it on the stand at the back if you see Emma. And this was to respond to the problem which we saw with old people being isolated, and some of them not being able to leave their home to do shopping first of all, and some of them didn't know what sort of events and opportunities were around them. So we created a mobile tablet, so a bit like an iPad, but it uses an Android device. We use that because it's cheaper, so you can buy a cheaper version of an iPad basically for £30. And we co-created an operating system, especially for people who've never used the internet before. So we designed it with over 300 older people in the north of Liverpool, in some of the most deprived estates. So this got people on the internet and allowed them to do online shopping in a really simple way. So it didn't rely on having the experience of what a browser is, or you didn't have to type anything in. You essentially just said, you know, what you want for dinner and what essentials you want, and then Tesco would deliver it the next day. Another nice feature to this was the calendar application. So what the calendar application does, it takes information off the internet and it puts it in an easy to read form for the older person, and it's specific to where they live. So there might be a social event going on in their neighbourhood, or there might be an attraction in the city centre which they might be interested in, and it connects them with their community. This is another interesting piece of technology which we're in the early stages of. Again, developed through the University of Liverpool Electrical Engineering faculty. It uses that chromosticity technology which I just mentioned, and it uses the webcam feature on a computer. And the problem it solves is it can detect if you've got a urinary tract infection, which is a problem which you'll go to a doctor or a medical institute to get tested. But what we do here is we can use the camera of the computer, and it can tell by colour essentially, and that's been proved to be successful. So the next stage we want to do with that is, rather than using the camera on a laptop, a webcam, is we'd like to use a mobile phone application. So we'll essentially use the same technology, we'll put it into an app. So this will greatly reduce the time it takes for people to get this test. We also created the in-hand application with FACT and Merseycare, and I'm not going to talk about that too much because someone's going to talk about that later, but you can check that out over there. Another group of people we've been working with is More Independent, and these are, if you don't know about them, I'd suggest you check them out. They're doing some really innovative stuff in the region, and we've been working with them to connect applications to the personal health records of people, and that's not really been done before. So that fall detector which I told you about before, we've been connecting that with personal health records with a view of developing the technology to not only detect when someone falls, but look at the gait and look at their movement patterns to actually predict what health needs they've got before they happen. So we're looking at detecting early stages of Alzheimer's and dementia, and again that would be working with clinical leads at AHSN who've really helped us. One more is the Vivo project, which we're working with More Independent. This is essentially a cross between Amazon and Which magazine for assisted living products. So we've created an aggregator. Essentially it's a website with all the products and reviews and links to buying the products, because at the moment it's difficult for families to know which products to buy for their loved ones to help the aging process. So just quickly, our approach is a user-centered design approach, and we believe in co-creation. As I said before, we're not experts in health and we're not the end user, so we bring those people, clinical people, the patients, we bring them right at the front of the design process, and that creates products that are useful and they get used. So we encountered the AHSN earlier this year, and they've been really good for us. And in the last year, our company's doubled in size. We've got twice as many team members. Our turnover's grown 300%. And we've really sort of started to establish as one of the best companies for this sort of technology in the UK. And part of that is thanks to our relationship with the North West Coast AHSN. So I'm just going to give you some nice examples of how we've worked together. They've provided a platform like they're doing today for me to connect with people in the health industry and health sector, which for someone like me, it's very confusing. It's very different to every market, and there's lots of acronyms, there's lots of bodies, and I don't know what they mean, but they're there to guide me and really sort of tell me who I should be working with and say, give me a platform like this. So in the summer, they had a competition which we won, and the prize was to work with the Foreign Office and essentially present to one of the leading Scandinavian health conferences called Digital Health Days. And from that, so we went to Stockholm, met the ambassador, got treated really well, but the bottom line is we're now selling our products into the Swedish market, which is a direct result from that AHSN platform. That's Julia, who some of you will know. She's really awesome, actually, and she's the person who's really connected us with the health sector, and she connects us with the NHS R&D body for the Northwest, which we didn't know existed until a few months ago. And like this, we spoke together at a conference in Bolton, and that's led to us now collaborating with this body, and that's thanks to Julia. I'd also like to say thanks to Lorna Green, the commercial director. I bumped into her yesterday and described her as hard-nosed businesswoman. I didn't mean that in a bad way. It's what I like, and she's connected us with the Alderhay Hospital and the Royal Hospital to get that fall detector technology into the new hospitals. She got us in at the right time and at the right level. So now both hospitals are going to be putting it in their trial rooms from January, which again, if it wasn't for that connection with Lorna, we wouldn't have known where to go, and we wouldn't have got the open door that we got. So just last week we were working with Philip, who's the clinical lead at Northwest Coast AHSN, and he was working very closely with Bridget, our open innovation lead, to essentially put in a bid to the UK government to get funding to develop that technology, the peace of mind technology, further, so it can work with outpatients and reduce rehabilitation times, because we'll have better data. And he's been so good for us to work with. He's provided that clinical knowledge which we'd never have, and he's always been on call, and he's really helped shape our R&D to enable us to sort of produce something which the market actually wants, rather than us guessing. Liz mentioned the European Health Alliance, and that's another body which we connected with via the Northwest Coast AHSN. So we joined this membership group, and two of our team have started spending time in Brussels, and they've connected us with companies of a similar size to ours across the EU, and that's led to us being part of several consortiums to apply to the EU for funding to make this technology a reality. So again, I hadn't heard of this organisation. We came to a day like this, we met them, and now when we go to Brussels, doors are opened for us. We're meeting other good companies, and we're understanding the funding landscape a lot more, and that's directly thanks to them. And I think, as you've seen today, they've just opened networks which we couldn't have dreamed of a year ago. When we had aspirations to work in health, we'd made an app with Merseycare, but So the Northwest Coast AHSN introduced us to the CEO of NHS England for us to present what we're doing in big data and Internet of Things, and that's the levels which we're connecting to via this organisation. So that's pretty good for a small SME like us who's been going 3 years to be springboarded to that levels is really good. So that's it from me. there's my details. If anyone wants to get in touch, I'm always open for a cup of coffee or just grab me at the breakout. Thanks very much.
Well,